What's happened under COVID-19 is that we've seen families torn apart. We've seen people not being able to be united. We've had a lot of challenges. In fact, Madam Speaker, I raised this, and I want to thank the Minister for Public Safety for talking with me about this as we entered into COVID before this House actually shut down, and the difficulties that we face because there's actually on our border, there's up to 2,000 people that commute as frontline workers supporting the efforts to fight COVID in the United States. We have doctors, nurses, PSWs, I'm a PSW myself, that are actually going daily over to the United States, and we have to keep them safe and secure. Now, the problem that we're faced with, Madam Speaker, as COVID has continued to hamper our economy, it's also created challenges for individuals that have loved ones that are across this globe. Whether they be as simple as in Detroit, Michigan, across from Windsor, or whether they be in England, or whether they be in some other Commonwealth nation, or even farther than that. And, Madam Speaker, what's happening is the government's response has been nothing short of irresponsible to this. There has been nothing but delay and continued pushing the issue down the road without any type of supports for individuals. And that hurts not only the families, Madam Speaker, but I would argue that hurts our actual economy, and more importantly, it hurts our entire community and actually our neighbors and all the people in our communities, because we have people that are in limbo. And, Madam Speaker, I guess I take this a little bit personal in the sense that, my aunt married American. I have representatives of entire populations across Windsor and Essex County that are connected to people from everywhere, from Lebanon to Pakistan, to India, to China, and other places. And there's been no recourse or no supports provided individuals to actually work through the COVID issue, and also providing safety and security of family reunification. And what we're talking about, Madam Speaker, is that the government's narrow definition of what a family is constituted has actually prevented and is actually flying in the face of this Prime Minister, who they've identified as basically direct relatives in basically an old, outdated system that doesn't even take into place the real relationships that are taking place right now. And, Madam Speaker, this affects people in a mental health aspect, and it also affects people with regards to connecting and actually family planning and so forth. So my appeal to the government is the issue over this is to be taken responsibly and to move forward. We have presented several plans in front of the government. And listen, I come from a community where we're on the front line. I started this speech by talking about how many vehicles and people traverse back and forth on a regular basis. We are just as concerned as anyone out there with regards to spreading of COVID and having the system of the United States impact in our community. But it doesn't take away from our determination to reunite families that need to actually have the process in place and the investigative and the supports necessary from the government. Nobody wants to bring somebody in this country to get their family members sick. But that doesn't mean grandparents, parents, cousins, family members, brothers, sisters should be isolated and thrown basically to an abyss month by month, not even knowing when they can reconnect. We can do better than that, Madam Speaker. We can do better by a full process, and we've presented proposals to the government, and they have not even responded. And Madam Speaker, there's a movement out there, Love is Not Tourism, and there's others that are pushing this issue, but they're doing so not just for themselves, but also for this country.
Ask members to please lower your discussions in the House so that we can pay attention to what the member is saying. Thank you. Proceed.
Thank you, Madam Speaker, and I appreciate that, because I think that my message is one that hasn't been discussed enough in the House of Commons here, and hopefully it will be resonated outside of this chamber even more so, because I believe, again, that it's not just about the individual families that don't have a connection. And I look towards in Windsor, where we had the Costello family, and people need to understand how draconian the system is. This is in Windsor, where somebody could, and we've asked for this, to go to hospice to visit a dying mother, Diane. She's passed away, and my condolences to the Costello family today. And thank you for all their family for fighting all these things. They didn't have to stop anywhere. They were going from the border to 8 kilometers to hospice, and it was originally denied by this government. there would be no interaction about anywhere else. Meanwhile, you can actually, Madam Speaker, you can drive across British Columbia to Alaska and then head to Alaska and come back, stopping several ways and places, and that's okay. But what we couldn't get, and we finally did, and I thank the government for doing this, allowing permission for the family to be together for the dying days. But this should not be a fight. This should be a planning process the government needs to wake up to and acknowledge that this could go on for a long period of time. COVID-19 is going to continue to plague us as citizens, but we can't fall into always saying no and not doing the hard work necessary to reunite families, whether they be loved ones, fiancés, whether it be brothers and sisters, all those types of relationships that are out there that are connected can be scrutinized. And Madam Speaker, there's been a tremendous amount of work done. So nobody is asking for somebody to come in willy-nilly into this country and get a free pass. They are actually putting forth themselves and their families high expectations, ensuring coverage, ensuring a plan, ensuring there's going to be follow-through and quarantining, all those things. But right now, the government is just saying no. They're just saying no, blanket no. That's not acceptable. That's not acceptable because this is going to continue to go on. And Madam Speaker, this hurts not only the direct people involved, but also our entire community. And that's what I'm trying to impress upon the system right now. We saw, the one case I referenced, the Costello family, and what I pointed out at that time, Madam Speaker, was a billionaire got into this country. A billionaire got into this country and to Toronto and got through the system. And the government's response was to blame CBSA. That's not acceptable. It's not acceptable to our workers to be put on that mantle and to be said that they are the problem. The CBSA workers are actually our frontline heroes. They deal every day with people coming back and forth on the land border, and they also deal with the air and other things. They need direction and support from this government. They just can't be doing it by themselves. And Madam Speaker, that's what we're calling for, is a fully accountable process that's been presented to the government. The government now is potentially responding now because they're feeling the pressure. Well, it shouldn't be political pressure. Madam Speaker, one case was enough. One case is enough, and you know what? It's not acceptable for us to continue to put people in pain by not knowing their future. It's not good for mental health. It's not good for the workforce. It's not good for the families. All of those reasons why we can do better. And that's where we're at, Madam Speaker. We can't change the past right now. We can't undo the damage that's been done. But what we can do is bring in a fully accountable, credible process for families to be reunited and ensure safety for the public. Surely we can do that. We have to do better. COVID-19 may not be going away for a long, long period of time. We have direct testing now available. Madam Speaker, the time is for us to change, for this government to change, and to reunite families.